Okay, thanks for tuning in today. Today is on the top 4 myths about ankle fusion. Ankle fusion is a fairly common operation, but patients have a lot of questions about what they can and can't do, and the information is pretty mixed out there. So hopefully we can just dispel some of the main myths regarding ankle fusion, particularly due to running and activity, sport and walking. Thank you for listening to the Foot and Ankle Surgeon. As always, your guide to foot and ankle surgery, and make sure you press subscribe or like on our videos. Now, in terms of ankle fusions, they're usually performed for osteoarthritis. They are different from hip and knee replacement, hip and knee osteoarthritis, and the patients are usually younger. The arthritis is usually what we call post-traumatic, so due to an injury rather than as a result of genetics or wear and tear. And most of the patients have a higher level of activity at the baseline compared to patients with hip and knee arthritis. Now, myth number 1 regarding ankle fusion: I will have difficulty walking with an ankle fusion. Now, you do walk differently with an ankle fusion. That's been shown in studies in terms of compared to normal gait, because we are changing what you do with your ankle. But the thing is that if you've got arthritis, you won't be walking normally anyway. And there are actually 2 studies that have looked at walking in patients that have had ankle fusions after arthritis or ankle replacements after having arthritis. And for both of them, they actually do pretty well. So both show an improvement in walking ability and walking activity after having the operation. So the ankle fusion certainly will help with your walking. In regards to myth 2, I'll be able to run and jog with an ankle fusion. Well, unfortunately, this isn't true. I'd love you to prove me wrong, and there's some patients that do prove me wrong, but the medical literature would say that you're not going to be able to run or jog with an ankle fusion, unfortunately. There have been 4 studies that have looked at sport or activity that you might not be able to do after an ankle fusion or a total ankle replacement. And these are generally sort of the higher impact activities or contact type sports, but running is included in that, although there is one study in total ankle replacement that says you jog more. So running, unfortunately, is unlikely. Tennis, unfortunately, is also unlikely. Basketball has been shown not to be able to be done after an ankle fusion, and the same with soccer. So these are the kind of things that have been shown in the medical literature that you probably won't be able to do after an ankle fusion, and this is important for you to be aware of. Now, myth number 3, so we've only got 2 to go. I won't be able to play sport after an ankle fusion. Now, fortunately, this is quite wrong, and the good thing is that a lot of people actually are able to play sport even before they have an ankle fusion, believe it or not. So there's something called a systematic review where they bring a whole lot of papers, studies together and mix the results, and they looked at sports participation before and after an ankle fusion. What they found is actually 73% of patients actually did sport, some level of low impact sport, before having the fusion, and then 70% of them participated in sport even after having an ankle fusion. So what that means is you can probably maintain your level of sport if you have an ankle fusion. So whatever you're doing before, provided it's not high impact, you're probably able to do. And what they found is patients could do things like swimming, hiking, cycling, and skiing, believe it or not. So these are the kind of things you'll be able to do after an ankle fusion if you were doing them before. Now, myth number 4. I won't be able to play sport to the same level after an ankle fusion. And just remember that all these myths or yeses are for patients that have a successful fusion. Alright, so this is a myth, this statement as well. So if you are playing sport, it has been shown that you will probably be able to play at the same level after an ankle fusion. So that same systematic review that I was talking about looked at before and after, and whether patients could subjectively do what they did before, and they could in all but 1 study, and there are about 12 studies including in the systematic review. So that's pretty good. That means that you'll be able to maintain what you were doing before. So in summary, you probably won't be able to run or jog after an ankle fusion, but your walking ability and your walking activity stand a good chance of improving if you have a successful fusion. Number 3 is you will be able to maintain your pre-op level of activity and perform sports such as skiing, hiking, cycling and swimming, but you probably won't be able to do contact or high impact sports such as tennis or basketball or soccer, or as we said before, running or jogging if you have an ankle fusion. So thank you for listening to us today. Make sure you hit the like button and the subscribe button, or come visit us at www.hunterfootandankle.com.au. Thanks once again for listening. Bye.